Hi, I'm Dr. Nikitow. Hey, Luke, I want to show you an adjustment real specific for the lower back, okay? Because when we work in our three-dimensional system, we look for sliding of the pelvis, which is what we call translation, and then we see rotation like this on this y-axis, which is up here, and then we can see torque where the hips are moving back and forth. Now, typically chiropractors work on torque. So they see the pelvis is shifted back and forth like that. So they'll lay you on your side, put your knee up, and so on and so forth. Luke's case, what he was complaining of is that he's complaining of back pain here on the left side. And it kind of waves up, right? And then he also mentions that he gets some pain down his leg, which we call sciatica. Now, what I want to show you is, come on over here. What I want to show you is when you're checking, okay, and this is for patients and chiropractors, what we'll do is check his pelvis here, and you'll notice that when I touch the front of his pelvis, this hand is way back and this is way forward. That's a true rotation. We call it negative Y. Now, let me explain why this is important to know. The classic symptoms when you have a rotated pelvis where it's like that way or this way, in his case it's rotating back on the right, he's going to override the joint on the opposite side. So when if you have a chiropractor working on you, and they're not doing this three-dimensional system, they're going to miss that, okay? The second thing is you can get pain in your groin, you can get pain in your privates, you can get pain in the anal area, pain walking upstairs and downstairs. It just feels like it's catching. And the next thing you'll get if it stays for a long time is pain in your hip joints and your knee, because when you rotate, your whole knee twists and your whole pelvis or your hip joint twists. So I'm going to show you the adjustment that we do for this. So I'm going to have him lay on his side. Go ahead and lay on your side, Luke, and face me. Okay, so what we'll do here is we keep the legs straight because we want to move the entire pelvis, okay? So this is what we're doing here. We're going to rotate him like he's rotating towards the table. He's letting it fall. We're just rocking him. And then we adjust it that way. Okay, let's get you up and walking around. So we always walk the patient after we adjust them because that fires what we call nerve receptors and they reset. So now come on over here again. And as he stands, now we'll recheck him, touching the pelvis here and touching the pelvis here. Now you can see the hands are even. So it's like if I slid my hands together, they should be even like this. Initially they were like that. Now he's even. So as the day goes on, what's going to happen after he walks, he's going to feel a lot better. But those are killers because they take and twist the disc and the joint and the nerve. And that's the one that'll wear the discs out 10 times faster. So if you're going to a chiropractor, make sure they kind of check that. Otherwise, obviously, if you're in our area, we'll be more than happy to check you. We can see what we can do to help you out.